Bear with me for 1 minute. And so I usually just like to start with just a real brief kind of slide deck, just PowerPoint presentation, just to kind of set the table a little bit and set folks' expectations around how we'll kind of plan to spend the next hour. Um, so yeah, we'll start in terms of an agenda, a very brief background on just PolicyMap and the Interact for Health enterprise site. For the demo, we have had a few of these sessions in the past. I know that today it's probably a little, it's always a bit of a mix between sort of users that are somewhat new to kind of the Interact for Health enterprise site, and then others who have, used the site, are pretty familiar with some of the basic functionality and are interested in certain, advanced features and kind of like reviewing some of the advanced features. So the plan for today is to do basically like a quick review of sort of site navigation and basic functionality. And then to spend a good amount of the session really getting into some of the details on certain advanced features, like using the data uploader, going through creating like multi-layer maps and kind of how you can use that for layering data and setting conditions to kind of filter down to areas that meet those different criteria. I'll save like the last 10, 15 minutes for a Q&A session. Um, I will, so feel free to drop questions into the Zoom chat as we're going through the demo. I'll mostly kind of save those for that Q&A session at the end, unless there is some kind of like natural breaking point to kind of pause and maybe address like a question that came in through the chat. So that's the plan. Um, so the Interact for Health Policy Map site, so what we refer to as an enterprise license or enterprise site, it's basically just means it includes kind of all the data, all the functionality of the Policy Map platform, and it's available to the Interact for Health grantees and partners. The URL for the site is interactforhealth.policymap.com. That's where I'll be pulling that up in just a second, and it is primarily focused on sort of the Interact for Health service area, kind of this greater Cincinnati or Southern Ohio, Northern Kentucky sort of region. This is just a quick sort of snapshot of some of the data that's available in PolicyMap for folks who are sort of new to the tool. So a lot of demographic data from the census, housing data from HUD, certain food access data sets, a lot of health data from like CDC, CDC places, um, cancer data, different data on chronic conditions. So household income and poverty data, and then lots of quality of life indicators too. But we'll go through a lot of the data during the demo. But there's a lot and a pretty broad spectrum of data sources and data topics within the tool. And this is a little bit of like a leave behind, but there's lots of resources. So, PolicyMap has a support page with guides and some like little quick video overviews, step-by-step tutorials. We do have just like a general support page, or I'm sorry, general support team. So we have like a support@policymap.com email, and we do have like help desk support during normal sort of business hours available as well. And then Interact for Health also does host a number of kind of brief use case videos that we collaborated with them on, kind of going through specific features and functionality directly within the Interact for Health enterprise site, and those are hosted on the Interact for Health page, the resources for PolicyMap users, and I can show that as well. So transition over in just a second here to the Interact for Health Policy Map site. So when you go to that interactforhealth.policymap.com, this is the landing page. So you'll see this little login screen. Here's Colleen's information as far as kind of the site administrator. So you would log in with your email address and password. And once you're logged in, you will kind of arrive here, kind of focusing on this greater Cincinnati region when you first log in. Up in the top right-hand corner is where we have links to our help docs page. So this is where you can find some of those different guides, tutorials going through, making maps. Um, this is all searchable too. So if you're, interested in information on the data loader, you can do, searches to find those entries. Um, Here's the video gallery, has like kind of like 2, 3 minute sort of quick overview videos of different features. There's also a what's new section here where we keep a running sort of update on um, new data that's being added, data updates that are being added to the data library and PolicyMap as well. Within the tool itself, there's also down here in the bottom left corner, there is this uh, we refer to her as Pam. It's mapped backwards, but Pam is basically like a little in-app sort of tutorial guide. So this is another resource. So sort of instead of navigating over to the support page, if you're just kind of wanting sort of like step-by-step walkthroughs within the tool for making maps or um, going through a multi-layer map example, these are also resources that are available there. Um, and then I'll pull up the Interact for Health URL as well, but this is the quick start or just kind of quick video tutorials. These are a little bit longer, a little bit more use case specific, but like for using custom regions, a multi-layer mapping tool, um, and some of these recorded webinars as well. And these are under data and learning. I think it's data map tool, and then resources for PolicyMap users. So that's kind of how you can find it as well outside of the direct URL. So that's just yeah, those are the wide range of different support resources and things like that that are available outside of this webinar and those other kind of previously recorded webinars. So in terms of just some of the quick site navigation things, you can zoom in and out. You'll see additional detail populate on your base map here. Um, We have so above the map window, this is where I just have to move this zoom bar. Above the map window is where you can we have our set location bar. So that's where you can search for an address or a city, a county, a zip code to kind of navigate to that location on the map. So if I put in a local zip code location, select it, it'll zoom me into zip code 45220 and show me the boundary for that location. We'll come back to some of these buttons a little bit later after we have some data displayed on the map. In the bottom right-hand corner is where you can find base map settings. So it's this little gear icon, and you can change the base map style. There's like satellite imagery or more of like a light base map. And then within each of these, you can toggle on and off different features of the base map. Like if you don't want to have roads or the building footprints, you can turn off different features of the base map as well. All of the data that's available from the PolicyMap data library is going to be organized into these data menus from demographics all the way over to the federal guidelines. And um, so everything is sort of organized according to sort of theme rather than by source to make it easy to find what you're looking for. And as you open these up, so if I, go into the health menu, these all kind of cascade into more specific sort of groupings of indicators. If I go to health costs and insurance, health insurance coverage, by income, less than $50,000. Then once I select one of those menu items, it'll load that data layer onto the map. There's also, in addition to sort of the typical policy map data menus, there's also this social drivers of health data menu, which basically kind of organizes some of the policy map data layers and data points into more of like a social determinants of health, social drivers of health kind of framework. So that's another way to sort of where the data is kind of presented and organized and maybe kind of especially for folks who are doing more public health related work or work related to social determinants of health. This is another way to kind of navigate the data library. And then lastly, we do have a data search. So you can actually search by keyword just to the left of the location search. So this is where, if I wanted to look for like pharmacy locations, I can search pharmacy, see the search results, select one of those options, and then load that on the map. In this case, it'll be a point data set showing locations of pharmacies. So we'll go through a few more basic functionality things, talking about sort of interacting with the data layers and data points to customize your map. Anytime you have data on PolicyMap, you'll see, for a data layer, you'll see a brief description over here. So in this case, it's percent of people living in households with income less than $50,000 per year without health insurance between 2019 and 2023. The source in the legend will show you that this is coming from the census. This comes from the American Community Survey data. If you click on the little eye bubble here, you can see more detailed descriptions. This one's pretty much the same, but in some cases you'll have kind of a more detailed description and a link to our data dictionary for the data source that this one's coming from. Um, when you click on that, it will take you to our data dictionary and navigate to the source entry that particular indicator comes from. And so the data dictionary has lots of details on um, the data, what years are available, last time it was updated, what geographies you can or display those indicators for, and then different descriptions on how we work with those different data sources. Some of the other options that are available for the data layers over here in the legend, you can toggle to different time frames, so keep the same indicator, but look at different time periods. You can change it,
There's
the
cool stuff in here.
variable from something like, an estimated percent to a count to more of like a percent change view, in which case it'll show some calculated percent changes in that particular variable. Um, you could change your color ramp. So the default is this purple for most of the indicators in PolicyMap, but you can, choose one of these other sort of preset color ramps. You can also create your own custom color ramp using that button down there. And then, set your color ramp and save that to your space, your workspace. And that's something that you can then like apply to future maps that you've created. The ranges in the legend are also something that you can adjust. So the default is that it's going to, basically break them up into 5 buckets based on sort of the distribution of that variable across the country for all census tracts in this case. You can adjust this by using this little ranges menu. You can change the number of ranges or um, use these sliders or edit these numbers directly to change what you're seeing on the map. So if you wanted like the top darkest purple areas with the kind of largest percentage of population without insurance to be like 25%, you could do that. You can make these adjustments and it's changing over on the map as you make those, change those sliders around. And if you ever want to just kind of
Right.
reset them, you can restore those to the default values as well. So it's Um, you can interact with the ranges here as well in the legend. Like if you want to hide everything that's not in those top two kind of highest percentages of uninsured populations, if you select those top two, it'll kind of hide everything else. You'll just be kind of focusing in on those areas that are particularly high rates of lower income folks without health insurance. You can remove those, clicking on those X's. And then the last thing is just that there is, this is, in the layer legend, you can change sort of the geographic boundary at which you're, viewing that data layer. So the default is mostly based on how close you're zoomed on the map. But if you wanted to see this indicator for zip codes rather than census tracts, you can just change that by selecting that different boundary type from the shaded by dropdown. If you click on an area on the map, when you have a data layer displayed, so if you click on like one of these darker purple areas, you'll see a little trend chart here just to show a little bit of change over time. You can expand this to kind of a larger trend view by clicking on this trends button. You can see how this, in this case, this census tract compares to some of the sort of the benchmark or kind of contextual areas in which it sits. You can see it's kind of a higher percentage of sort of lower income population without insurance compared to the city of Cincinnati and the state of Ohio. You can do those kind of comparisons really quickly. Um, and then you can see a larger trend chart if you click that button to see a chart with the listed locations and add some of these contextual areas to the chart as well. And that's how you can just kind of create really quick trend charts and export these as images out of the tool. So for the point data, in this case, these pharmacy locations, you'll see the source here. That'll link to the data dictionary for that point data set. For the points, you can adjust, you can like turn on and off labels. Um, you can change the icon shape, size, and color if you need to, you're having a little bit of a hard time seeing how those points are represented on the map. And then there's filtering options on point data sets. So you open up the filter menu, you can see the different kind of filtering options. This will all really kind of just depend on the attributes that are available for the particular point data that you're looking at. But if you wanted to, for example, do like a filter based on parent chain and just look at the CVS and Walgreens locations, you can apply those filter options there. And then it will just be seeing like a subset of the pharmacy locations. If you click on one, you can see the attributes um, for the pharmacy locations or for the point data that you have displayed on the map. So you can also add um, boundary overlays on top of a map that you've created. So just to the left of this custom, the social drivers of health tab, there's a boundaries tab, and this is going to have like zip code boundaries or census tract boundaries. A lot of like the standard census boundaries are going to be in here, counties and states. There's also some legislative district boundaries, which can sometimes be helpful for if you're kind of making some maps for legislators or for kind of like advocacy type of work. So you could put on those boundaries, they'll overlay on top. So you'll see those as those light black outlined boundaries, and you can change the kind of style of these and make them kind of like a heavier line weight or a dashed line. You can change some of the font sizing for the labels, and there's also some different color options as well. So I'm gonna come back up to the location bar here and select Claremont County and come back to some of these buttons that we had uh, kind of saw at the beginning when we were searching for a zip code area. So set Claremont County, I have some data on the map, and so when you've selected another a location through the location search, um, you can use that in this case the county boundary to
I've
clip to the
got
map.
through now.
Um, and so you can clip your map to that selected location, kind of hides everything outside of the county. You can use this white background option to kind of really like just customize your map to that selected location. That white background is down here in the bottom next to the little scissor icon, and you can remove the clip by kind of undoing the scissor icon. Um, and so that was the clip. You can also um, use the selected location to, view a table. So basically view kind of all the census tracts that fall within Claremont County with the estimated values for the data layer that you're looking at that'll show up here on the right-hand side in this sidebar. You can toggle to view the pharmacy locations as well. So you can see these are the 10 CVS and Walgreens locations within that county. You can use this location to also download data. So you can generate quick downloads using the download tab over here in the sidebar. And I'll come back to the download in just a minute. There's also a couple of just built-in sort of standard reports. The community profile is like a going to generate just a very kind of um, quick kind of summary of like demographic indicators. The community health report can be run for counties and census tracts. It has a lot of like health related data, some other, and also some demographic data. And there's also a standard report for housing and home mortgages. Um, the community profile report, I'll just generate one of these really quickly, just so that we can kind of see how this looks. So it will show your report area and just talk a little bit about some of the, areas it's located in and boundaries that it touches, but has these types of tables which just sort of show like population change over time for your area, how that compares to the state, some population by race, ethnicity, breakdowns, age distribution. There's lots of just sections like this. And again, they're just sort of a way to, navigate to a location and generate like a very kind of quick community profile, community context summary. So that's just some of those buttons that are available when you have that location selected. Um, so when you've created your map, I'll put my clip boundary back on here. And so once you've created your map, so some of the outputs that you can produce. Um, in this bottom right-hand corner is where you'll see there's a little printer icon or a little print button, which allows you to export either a PDF or an image of your map. You can also show you a little print preview. You can change different options about how that map looks. Drag things around here. Zoom in and out and center things around. You can choose whether to include certain legends or not, scale the text size. So there's lots of different kind of ways that you can just kind of tweak and adjust your export before you actually generate it. And then here's where you would choose either PDF or PNG to produce that. You can also save maps that you've created so that you use the little save icon below the printer button. This will allow you to save it into a workspace and kind of come back to it later. You can customize the name. Right below the save button is the saved workspace. So this is when, next time you come in, if you wanted to come back to that same map view, so it'll kind of save it to that selected location with the data that you have on the map, and you can come back to it in a future session and just kind of load it from your saved work. You can also share maps that you've created. So that's going to be the button right below the saved work. And this is where you can create a link and share it with another user of the Interact for Health site license. You can also just sort of, send the email, directly put in the recipient email address here. And then there are embedding options as well. This particular map I have on does have a third-party data that has some licensing restrictions, but without the pharmacy locations on. If you wanted to just create like an embeddable map showing, the population without health insurance indicator, these are, nice little kind of interactive maps that you can kind of like simply embed like on a project web page or a site like that. And then quickly mention download, but outside of the little sidebar download that you can access from this, location bubble, we also do have up in the top right-hand corner, there's a download button. Um, which will allow you to, choose what you're going to be downloading, your data layer, your data points, how what location you want to download it for. It'll usually kind of use like what you have displayed on the map, but if you wanted to change this and download it, for the whole state of Ohio, you can change your location there, decide whether you want census tract data or zip code area data, and then choose how you want to receive it, email, just have it come through your browser. And you can also customize the name on those as well. So um, those will just come out as CSV files, which you can then open up in Excel. I'll just open up an example so you can get a sense of what these look like. So In this case, it's the same indicator that we were just looking at. It's, percent of people in households with income less than $50,000 without health insurance. Um, it's census tract level data here. Over here, this is one that I generated just for Claremont County, but it'll give you the data source and the time period of the data, and here's the actual values for each of those census tracts. So, has pretty much everything you would need to kind of do additional analysis, or if you wanted to, use this to kind of create even maps like with desktop mapping tools and stuff like that outside. It has like all of the identifier information you would need. So, but that's just a quick view of what these look like when you open them up in Excel. So I'll transition into the advanced features. I did see there was a question about does the PDF option produce an editable vector file? Um, I actually don't know the answer to that, but I can get the answer and make a note of that, and I can follow up because I'm not sure if it would be highly editable in like an Adobe kind of suite tool after you would export it or not. So I can find out about that. So I'm gonna reset my map using this little button in the bottom right-hand corner, and this will kind of reset out to the default view. It kind of clears everything off of the map. I'm not sure why it went out to the full US, but it'll kind of clear all your data layers and data points off of the map and kind of bring you back out to the default view. So we'll jump into the data loader. And so this is going to be kind of moving into more of the advanced features. So the data loader allows you to upload your own address level data into PolicyMap and then be able to kind of display it on the map as point locations. So I'll show the just data sample that I'm going to be using for this demo, just so you can get a sense of, what we'll be importing here. So this is just a very sort of basic, simple data set, a couple hundred records. I have the address, city, state, and zip code. Those are going to be kind of like the real kind of key fields that you'll need to be able to run it through the geocoder of in PolicyMap and actually display those as points. You can have other attributes. In this case, I just have like an ID and this availability attribute, but you can have more, up to like 50 columns in your data set. You can also upload as much as up to 10,000 rows per batch. So you can have lots more than what we're going to be showing, but this is kind of just a simple example. And so I have this saved as a CSV. So that's just like the file type you would want to. So if you have your data like in an Excel sheet, just save it as a CSV before you try and import it. So that's the data. And using the data loader, that's going to be up here in the top right-hand corner, that little kind of upload button. And so first I would choose my file or just drag it over. I'm just going to bring this over to um, the import box. There's different tips here and like a sample spreadsheet. The tips just kind of go through kind of how to set up your file. You can give this a name. So, I'm just kind of going to use this example as like you know, something like food pantry locations. Here's where you can set viewing permissions for this data that you're uploading. Say like just for yourself, you can do select individuals and put in their email addresses here, and then they'll automatically, be able to access this data that you're uploading. There's also this option for all enterprise license users, which, would just allow for any user the Interact for Health site to be able to have visibility and load this data on the map. So you'll see it, this little note below it indicates that all users will have permission to download the data as well. And this also gives you the ability to view it publicly through different share options. So like if you wanted to be able to create a shared map link that's sort of publicly accessible, or to create one of those embeddable maps, you would use this all enterprise license users as the kind of the viewing permission to be able to take advantage of those abilities to share kind of more broadly. You can choose the icon shape and color here. And then the next step is to actually import the spreadsheet. You tell the data loader, what the address field, the relevant address fields are. Usually, if they have pretty standard names, it's just going to pick it up on its own, like it did in this case. If you have latitude, longitude data, you can also just use that and just select, here's the lat and the long, and it'll just kind of use those rather than running it through the geocoder. So we'll click on the geocode spreadsheet, and the next step will be just like a summary of the geocoding results. So it'll tell you how many points were successfully geocoded. Here you can set a labeling field. Um, you can view your results here and sort based on these different columns. So typically users will kind of sort based on this geocoded column and see the ones that are indicated with this red X are the ones that weren't geocoded. You can make edits directly to addresses, clicking on the little pencil icon next to an address record. In this case, correct like the street address number. Once you click on done, it will try and re-geocode any of those edited records and then just update your summary count of successful geocodes. So you can do edits, as needed to try and kind of maximize the number of kind of geocoding matches that you get here. And then you can save and continue to move to the next step, which is the next step is where you can add filtering options. So you'll see just like a little preview of the points that you've uploaded that were successfully geocoded. And here you can add filtering options. So if you wanted to be able to filter based on that availability attribute, which was just sort of like a very simple full-time slash part-time, you could turn on a filter group. So I turned on this availability filter. I can choose whether to include like a color coding option. So that will, if I click on this little checkbox to preview it, that will, color code the food pantry location points based on that filter to show, the part-time in orange, the full-time in gray. And so once you've added any of these filter options that you want to add, then you can click on this save and continue, and that pretty much takes you through the process, and that's really just going to show you a little preview on the map and show you just sort of some of those selections that you made. You can download the points directly from here. You can delete this, edit it, kind of go back and edit to previous steps. I'm just going to click on view on the map, and we'll actually see this data displayed on the map. So um, let's see. So here, if you click on a point, you can see those attributes for the points that you put in. Um, if you ever need to go back to, or I guess sort of once you have this data on the map, um, you'll be able to access it under the social drivers of health tab. This far right-hand column is where any data that's loaded, that you've loaded through the data loader or that others have loaded through the data loader and have kind of like either shared with you or shared with all site license users will appear here. So if you do, use that option of sharing with all site license users, then this is kind of how other users can access it. Or similarly, if you share it with individual users, they would be able to access it here. Um, you can edit it, go back and make edits, clicking on that little edit um, pencil icon there. You can also always go back to the data loader itself to access any data sets that you had previously uploaded using this second tab to access some of those data sets and then make edits or delete it. As you need. So yeah, so that's and since I set this one up as publicly shareable, I can create publicly shareable maps. map links. I can, include it like in an embed map. Um, so I do have that ability to kind of incorporate into some of those like, public sharing options. So for go back to so we can remove the point data that we've uploaded, clicking on the little X to remove that from the map. So um, I'm gonna hop over to do just like a quick walkthrough of multi-layer mapping, and then we'll kind of circle back to some of the questions that folks had. So the multi-layer mapping tool allows you to add multiple data layers, set specific conditions on each layer that you've added to be able to see intersection across different data layers, or overlap, or non-overlap across different data layers. You can kind of see some like geographic relationships with the data that you've uploaded. So I'm going to go through this example of kind of like a food insecurity example, put on a few data layers related to food insecurity. So to get to the multi-layer mapping tool, in the top right-hand corner of the map window, you'll see you can toggle from the single layer view to this multi-layer view. The the menu, the data menus will kind of fill in this purple color just to show that you're in sort of the different multi-layer view here. And so I'll go ahead and I'll add on my first data layer. I'm just going to search for food stamps, and we'll put on this percent of all families receiving food stamp or SNAP benefits as the first data layer. So this will add this to the map. I'm going to zoom out a little bit. I want to kind of view this at zip code area. So I can change that over here in the multi-layer legend. I can change that shaded by to zip code from one of the other boundaries that's available. And then I'm going to select this map extent button, which pretty much just kind of changes your distribution, this kind of histogram here, so that you can kind of set your cut points on your different, data layers based on the distribution of values within your current map view. It's a way to just kind of provide a little bit of like local context as you're setting sort of the conditions on each data layer. So, but basically, when you put the first data layer on, you really have to change the criteria over here in the legend or set specific conditions in order to start getting any insights. Otherwise, the whole map is just kind of filled in purple. But um, you can drag this slider kind of for either this bottom range or this top range to narrow down to areas that meet specific conditions. And so I'll drag this up to 12%, which is kind of relatively high. And so this will be now sort of what's remaining shaded on the map is those zip code areas where more than 12% of families receive food stamp or SNAP benefits. And so this is a census indicator, so you'll see that reflected there in the multi-layer map legend. So that's my first data layer. Then I can add another data layer. You can click on this to add a layer. You can also just sort of navigate through the menus or use that data search. So I'm going to put on one of the health risk factors, so a CDC places indicator on estimated population that is food insecure. So that's going to be my second data layer. I haven't changed any of the conditions for that second layer, so the map is, pretty much going to look the same. But if I wanted to focus on sort of where there's relatively high percentage of food insecure population, I can drag the sliders on this one to, a little over 13%. And now it's going to be showing kind of kind of a more narrow, kind of filtered subset of zip code areas. I can temporarily disable this layer just to kind of show the difference. So if you reapply it, you'll see that, some of those purple areas are going to be removed because we're, again, sort of filtering down to those areas that meet, multiple conditions. So now we have these two data layers on. I could then add a third one, maybe like a health kind of chronic condition for population. Or I'll do the another risk factor, and we'll do adult population living with obesity as our third data layer. And similarly, you really have to set the criteria on that layer to kind of narrow down the areas um, that you're focusing on or kind of filtering down to. So in this case, I set the this to be zip code areas where obesity percent estimated percent of people living with obesity is greater than 40%. So now I have all three of these data layers on. And again, you can disable certain ones using the little eyeball icon to kind of temporarily remove them and reapply them just to kind of see how the map changes based on those different conditions being applied. So the purple areas are essentially those zip codes that meet all three of the conditions that I've set. So if I click on one of the purple areas, then I can see, this is a zip code area with 16% of families receiving food stamps, uh, estimated food insecure population being above 21%, and obesity above 43%. So that's why this one is still filled in purple. If I click on one of the areas that's not filled in, you'll see, that these don't meet the conditions that we've set. And so that's why it's not filled in anymore. So you can add up to 5 data layers in the multi-layer mapping tool. You can also then like add data points on top. Um, if you wanted to put on something like those pharmacy locations or even like the data that you uploaded through the data loader for like the food pantry locations, you can, put those to display on top of your map. You can put on boundaries if you wanted to be able to differentiate sort of the state boundaries a little bit better. You can add those on the map as well. And you can also toggle this view from the and sort of intersection view, which is going to be, you know, focusing in on those areas that meet all of the conditions to this or view, which just shows overlap. So it's going to show you kind of different, each layer will have a different sort of fill associated with it. So the blue zip codes are going to be those that meet the SNAP criteria. The different diagonal line fills will correspond to food insecurity and obesity. And you'll be able to see where there's overlap as well as kind of areas of the, you know, map where there's non-overlap across those different criteria. So that's just like another sort of way of viewing those multiple layers in the multi-layer map tool. Kind of just gives you like a little bit of a different visualization. So once you've created your multi-layer map, um, you can, over here again in the bottom right corner, you can export these using the little print button. It will save your criteria in the legend. You can give this a title or description, and again, sort of adjust any of the kind of print options before you export it. You can save these to your saved workspace. You can also share these with other Interact for Health site license users as well. Just create that link and share that with another user, and it will, again, save kind of all of your data layers and your criteria and kind of the location of the map that you're looking at. And then there's also, outside of the actual kind of sharing of the visualization or the map, we've also just very recently, as of basically last week, added the ability to download the data from your multi-layer map. So that download button up in the top right-hand corner you'll see is available. And this will allow you to generate a download that basically kind of reflects what you're seeing on the map. So gives you a little summary here of, what you're going to be downloading. It's those purple areas of intersection where all criteria are being met. Here's the, recap of the criteria that you had set for each of those 3 data layers. Um, and so then if I put in a location, you could say like a specific, all the zip codes within a specific county, or we could generate this download for the whole state of Ohio or Kentucky. You can also download these for custom regions that you might set up. That's kind of like your own sort of custom study area, and give this a unique name and just set how you want it to be delivered, email, browser, whether you want sort of it to be human readable, which just means like it has headers to the columns, or want it to kind of just have like a separate metadata file with it. So I'll click on download, and so that'll either generate through your browser and you'll see it kind of up here as like a download that you can access, or you'll get it through your email. So I'll just show sort of what this would look like. You receive just like a little zip file when you download one of these multi-layer map downloads, and you'll get a multi-layer map specifications, which is basically just going to memorialize the criteria that you had set when you generated your download. Here was the three data layers, here were the value ranges that I had set, the geographies for each of them, and what variable I was looking at in the source. And so that just gives you, kind of a recap again of what you had set in terms of the multi-layer map before you generated the download. And then you'll have an actual kind of data file. In this case, I'll just open this up in Excel. And so in this case, it's just going to show, the download was generated for Ohio. Here's my zip code areas, and then here's sort of the three indicators that I had on the multi-layer map and the values, for each of those indicators. So again, it's going to be filtered to just those zip codes that, met the conditions across all three of those data layers. That's what's going to be reflected here. So it's not all zip codes in Ohio. And those, the values for each indicator, it's going to be essentially kind of like what you see on the map. These zip code areas are what is going to be included in your download file, um, based on the conditions that you set. So that's, just a quick view of kind of how these ones would look. So, but it does give you the ability to export, like multiple indicators out of the tool once you've set up one of these multi-layer maps. And so yeah, so since we're at 150, um, I'm gonna hop into just kind of answering some of the questions that have come in. So let me just kind of find my last place. And I'll try and just run through a couple of these questions. Okay, so yeah, so in terms of does PolicyMap have the ability to create custom heat maps? Um, so right now, um, in terms of like uploading your own, data layer, we don't have that ability. So if you had like your own sort of zip code data on something that's not available in PolicyMap that might come from like a local source on something like housing evictions by zip code in the city of Cincinnati or something along those lines, you don't have the ability to upload those into PolicyMap at this point. Really, the data loader is limited to uploading just like point data. To be displayed as address kind of or address level data to be displayed as points. That's really kind of the what you can upload. Um, but yeah, it's definitely kind of creating, I think, kind of more um, functionality around users being able to like upload their own data or take point data and kind of generate heat maps based off of that. That's definitely stuff that we're kind of interested in pursuing in the future as kind of, future product development for sure. There was a question about data security for data that you've uploaded for yourself, myself only, and I can take a note just to share that with Colleen. We have like some standard documentation about kind of like how data is stored that's uploaded through the data loader, so I can share that afterwards. Um, So let me just make a note of that one. And yeah, there was a question about, do these maps have the ability to be shared within an organization and remain interactive, like sharing via a link that people could click and hover over the points to be able to see the data behind the points. So anytime share one of these links, those will all be interactive maps, especially so like in this case, sharing from multi-layer maps, it's really you have to share with users who have an Interact for Health, access to the Interact for Health site. Um, but if I go back to the single layer map view and if you just have like a data layer on and you want to share an interactive map link, if I click on this share button again in the bottom right hand corner, so there's these two options when you just have data that's sort of not like third party data that's sort of restricted to just users so like that have a seat to the Interact for Health site, that is this share publicly. And this basically just gives you a link um, that you could share with anybody. They don't have to have access to the Interact for Health site. And it is like an interactive map. So they would be able to open it and it would kind of save all of like your view and what data layer you have on, and they'd be able to there's a little bit more limitations to it for like a user who doesn't have a like a login to PolicyMap, but they'd be able to at least kind of pan around and see the values on the map and interact with it still. So it's not like a static kind of like PDF or anything along those lines. And yeah, we talked about there's the question, similar question about uploading sort of like shapefile or boundary data, but it is really just address data to be displayed as points right now. So I would say that yeah, for the most part, outside of what I shared just a second ago in terms of sharing links, like sort of these publicly shareable links with just sort of like census data or certain like CDC data. Those you can pretty much, again, share just sort of as like public links. And the recipients of those wouldn't necessarily have to have a login to the Interact for Health site. But primarily, I think what we've been sort of demoing today really does require, having access to the Interact for Health site. And sorry, I'm just continuing to scroll through. I think it's mostly just questions about access and stuff like that. So I don't think there were any other sort of feature or functionality questions. If folks do have, we still have 5 minutes. So if folks do still have things that they wanted to drop into the Zoom chat, um, definitely do so. I'll just kind of, as folks may be adding some things there, I will just address like a couple of maybe more broad stroke questions that came in through the user survey, just a couple of things that Colleen had shared with me that I can just kind of speak to a little bit. So one is just, it's a pretty common question, but like how often is the data in PolicyMap updated? So the short answer is that we basically update the data as the sources update them. And there's variation. So certain sources, update their data once a year, like the Census American Community Survey data is only updated annually. So typically that happens in December. This year it's happening in late January because of the federal shutdown. But basically, once those, the sources update their data, then we usually try to have those updates reflected in PolicyMap within roughly about like a month of when the data source releases it. But it is kind of like a rolling set of updates throughout the year based on when the data source updates their data. And like I said, kind of at the beginning, the help docs page does have this running feed of like new and updated data, which just kind of shows like as data updates are happening, which data sets are being updated and what new data is being added. And speaking of new data, just like a couple of newer data additions that we've made. We recently added this kind of interesting um, chronic health conditions prevalence index, which basically kind of took like a lot of the chronic condition indicators from CDC places and created like a ranked index for areas that tend to have a high percentage across multiple chronic conditions. So that's under health conditions, chronic conditions, and it's this top one, chronic condition prevalence. And it basically just kind of is somewhat similar to other like ranked index kind of indicators, or it just shows like areas with a high prevalence, moderate, lowest kind of prevalence in terms of chronic conditions or chronic diseases sort of across the spectrum. So that was kind of a new one. So sometimes it's data like that where we're taking a source and doing like additional analysis on top of it. Um, and then other times it's kind of like we recently added medical debt estimates from Urban Institute. So we're always trying to add new data sources, or sometimes, yeah, kind of create sort of like new data based on existing sources. Um, in terms of, so there was a question just about, is there a process for vetting data for quality for those that are uploaded by users? I wouldn't say not on our end. I mean, the data that users are uploading, I think that can be shared with all site license users. We're not necessarily like vetting or anything along those lines for accuracy. So I think it's really kind of you know, probably most of the onus I think is probably like on the author or the creator of that data, that like if they are sharing it with all site license users, that there's kind of that it seems like it's data that's complete or accurate or anything along those lines. Fortunately, there's not really necessarily like a space to kind of provide like descriptions or sort of like those kinds of things. So that's kind of a note to take, just that it might be helpful for people to be able to provide more context to data that they've shared with all site license users. But the short answer is that no, we don't kind of do kind of like validation per se on like data loader data. And there was a question about taking requests for data sources to add or create. And yeah, we definitely are open to those kinds of suggestions. A lot of the data that we add to the platform usually is based on sort of like requests, like common requests and stuff like that we're getting for new data additions. We tend to just have like in terms of the data that we add to PolicyMap's data library, which is like available for all users. We tend to have like certain like key requirements, I guess you could say. So like typically data that has like nationwide coverage because the tool itself kind of has the ability to sort of create maps and stuff like that across the whole US. Typically something that's more like sub-state level, just because there's limited sort of utility within PolicyMap of like data that's just state level data, though that's not entirely kind of like a hard and fast rule. Um, but otherwise, yeah, I think, and usually just like reputable sources and things like that. I think sometimes some certain suggestions, it's kind of seems a little bit like more of a research project or one-off, and there's no guarantee of kind of ongoing updates, and so it's that can sort of limit the um, kind of the long-term kind of viability of kind of including that data source. So, but yeah, we're definitely open to suggestions around that for sure. So yeah, so I think we're at 2:01, so I don't want to take any more of people's time. But I appreciate everyone who attended and for all of the very thoughtful questions. And yeah, I hope that everyone enjoys the rest of their afternoon. And I can stop sharing.
Thank you all. Thanks, Brian, everyone.